Kidney disease is creeping up on millions of people without them realizing it, and the warning signs are often dismissed until it's too late. Every day, countless individuals overlook the signals their bodies are sending, unaware of the silent damage unfolding inside them. The shocking truth is that nearly 800 million people worldwide are living with kidney problems, and more than 85% of those in the early stages don't even know their organs are failing. These remarkable organs filter close to 55 gallons of blood daily, and when they begin to falter, the body responds with clear warnings that should never be ignored. In this video, we're uncovering the 13 vital red flags that your kidneys are in trouble, symptoms often mistaken for nothing more than stress or the natural process of aging. Before we dive into these critical signs, if this is your first time here, we're glad you've joined us on the path to better health. Our mission is to arm you with life-changing medical knowledge so you can protect yourself and your loved ones. If you're ready to take charge of your health, tap that like button. And make sure to subscribe, because the information we share could be the key to catching serious conditions before it's too late. Share your country in the comments. We love seeing how far our global health family reaches. Now let's begin the countdown of the 13 early warning signs of kidney failure, starting with the first one: fatigue and weakness. 1. Loss of appetite and unexplained weight loss. Imagine sitting down to a dish you normally love, only to find you have no interest in eating. Or perhaps the scale keeps dropping even though you haven't changed your diet, and people around you are pointing out how much thinner you've become. While losing weight without effort might sound like a gift, in the context of kidney disease it signals something far more serious. It reflects the body's struggle with a toxic overload that disrupts even the most basic survival instincts. Studies highlighted in nutrition and clinical practice show that appetite loss in kidney disease is not simply about feeling less hungry. It is the result of a complex metabolic disruption driven by uremic toxins. These toxins interfere with the normal regulation of hunger by blocking the release of ghrelin, the hormone that usually triggers the desire to eat. At the same time, they stimulate inflammatory compounds that tell the brain to suppress food intake. The outcome is a profound decline in appetite that can bring about unplanned weight loss and muscle breakdown. This becomes a dangerous cycle, because inadequate nutrition not only weakens the body but also speeds up the progression of kidney damage itself. 2. Dry and flaky skin. If your skin feels unusually rough, itchy, or starts peeling despite using moisturizers and drinking plenty of water, it may be more than just a cosmetic nuisance. Persistent dryness can sometimes point to deeper internal problems linked to declining kidney health. The skin often acts as a mirror, reflecting what's happening inside the body. Research published in the International Journal of Dermatology shows that healthy kidneys are essential for maintaining the delicate balance of minerals, vitamins, and nutrients that keep skin smooth and resilient. When kidney function weakens, this balance begins to break down. Impaired kidneys struggle to control phosphorus levels, causing disruptions in calcium and phosphorus that interfere with skin cell activity. Kidney disease also contributes to deficiencies in key nutrients such as vitamin D and B vitamins, both vital for skin repair and vitality. On top of that, the chronic inflammation that accompanies kidney disease reduces collagen production and weakens skin elasticity. The result is dryness, flakiness, and irritation on the outside, signaling that serious imbalances may be taking place within. 3. High blood pressure. Your blood pressure continues to rise, and even medications seem powerless to bring it under control. At first, this may appear unrelated to your kidneys, but in reality, the two are so closely linked that damage in one almost always disrupts the other. This creates a vicious cycle that can quickly accelerate organ decline. According to findings reported in the Hypertension Journal, the kidneys play a central role in regulating blood pressure through several pathways. They manage the volume of fluid in the bloodstream, produce hormones that influence how blood vessels behave, and maintain the delicate balance of sodium and potassium. When the kidneys begin to fail, these systems collapse. As a result, excess sodium and water remain in the body, raising blood volume and pushing blood pressure higher. At the same time, diseased kidneys may release too much renin, a hormone that forces blood vessels to tighten. Together, these changes drive blood pressure upward, placing the heart, blood vessels, and kidneys under even greater strain. 4. Puffiness around the eyes. You wake up and notice your eyes look swollen, almost as if you spent the night crying or barely slept. While it's easy to blame this on a restless night or seasonal allergies, consistent morning puffiness around the eyes may actually point to early kidney trouble that deserves immediate attention. Medical studies explain that the area beneath your eyes is especially prone to swelling, because the skin there is thinner and more fragile than anywhere else on the body. When the kidneys lose their ability to properly filter protein, important proteins like albumin slip into the urine instead of staying in the bloodstream. Without enough protein in circulation to maintain fluid balance, liquid seeps out of blood vessels and collects in nearby tissues, most noticeably around the eyes. The timing is not random. This swelling is usually most obvious in the morning because lying flat during sleep allows fluid to accumulate in facial tissues overnight, leaving the eyes looking puffy when you wake. 5. Poor concentration or brain fog. You walk into a room and can't remember why, or you find yourself rereading the same sentence again and again without grasping its meaning. At times, it feels as if your thoughts are trapped in a heavy fog. This mental haze isn't always a simple byproduct of aging or stress. It can serve as an urgent signal that harmful toxins are disrupting brain function. Research from the American Journal of Nephrology shows that when kidneys fail to properly filter waste, those toxins circulate throughout the body and eventually reach the brain. Certain uremic toxins are able to cross the blood-brain barrier, directly disturbing the way the brain works. Doctors call this condition uremic encephalopathy, which impacts memory, focus, and cognitive clarity. What makes this especially alarming is that studies reveal even individuals with early or mild kidney disease may already experience measurable declines in thinking and concentration. This means brain fog could be one of the earliest signs that kidney health is deteriorating, a warning that should never be dismissed. 6. Muscle cramps. Sudden, agonizing cramps that seize your muscles in the middle of the night, shocking you out of sleep with pain so sharp it feels as if the muscle is being torn apart. These are not the typical cramps you might get after a long workout. They strike harder, happen more often, and can appear even when you're completely at rest. When cramps like this become persistent, especially in the legs, it may be a sign that your kidneys are no longer keeping essential minerals in balance. Findings reported in Kidney International reports show that healthy kidneys are responsible for carefully regulating electrolytes, such as sodium, potassium, calcium, and magnesium. When kidney function falters, this balance becomes unstable, leading to painful muscle contractions. A drop in calcium can trigger severe cramping, while excessive potassium may cause dangerous disturbances in heart rhythm. Although the legs and feet are usually affected first, the cramping can gradually spread to other muscles throughout the body, turning a nighttime nuisance into a serious warning sign of kidney dysfunction. 7. Metallic taste in the mouth. Imagine every bite of food tasting like loose change or aluminum foil, turning the simple act of eating into something unpleasant. This strange, lingering metallic sensation isn't just an irritation, It's a signal that harmful waste products are circulating through your blood. According to the National Institute of Diabetes and Digestive and Kidney Diseases, uremic toxins interfere directly with both your taste buds and your sense of smell. The result is a constant metallic or ammonia-like taste that makes food unappetizing. Some people describe it as if they were tasting blood or tiny bits of metal. This disruption has serious consequences. When everything tastes foul, appetite naturally decreases, leading to poor nutrition and unintended weight loss. Alongside the altered taste, many also experience bad breath with an ammonia-like odor, caused by those same toxins being expelled from the body through the lungs. 8. Persistent itching. A relentless, overwhelming itch that feels like it comes from beneath the skin, refusing to fade no matter how much you scratch. This is not the typical irritation caused by dryness or seasonal allergies. Instead, it can spread across the entire body, becoming so unbearable that it disrupts daily life and peace of mind. Research published in Clinical Nephrology reveals that up to 90% of people with advanced kidney disease suffer from this kind of unrelenting itching. The reason lies in the kidney's inability to properly filter waste. As toxins such as phosphorus and urea accumulate in the bloodstream, they irritate nerve endings throughout the skin, creating a sensation that feels like it's burning from the inside out. The buildup of phosphorus also disturbs calcium balance, causing calcium-phosphorus deposits to form in the skin, which only worsens the discomfort. What makes this symptom especially cruel is that standard anti-itch remedies often provide little relief, since the problem isn't on the surface of the skin, it's rooted in the chemistry of the blood itself. 9. Nausea and vomiting. Ongoing nausea that appears without warning, a fading appetite, or even a sudden dislike for foods you once craved, may be your body's alarm that it is being poisoned from the inside. When the kidneys can no longer clear toxins effectively, these waste products build up in the blood, leading to a condition known as uremia. According to the National Institute of Diabetes and Digestive and Kidney Diseases, uremic toxins have a powerful effect on the digestive system. They irritate the lining of the stomach and disrupt the brain centers that regulate appetite, resulting in persistent nausea, frequent vomiting, and a complete loss of interest in eating. This isn't the kind of stomach upset that passes in a few hours. It is your body's direct response to toxic substances that should have been filtered out. The nausea often comes in waves and worsens over time as kidney function continues to decline. 10. Shortness of breath. You reach the top of a staircase you've climbed countless times before, yet suddenly you're gasping for air. Tasks that once felt effortless now leave you drained and breathless. While most people immediately suspect heart or lung issues, the kidneys can often be the silent culprit behind this struggle to breathe. A large-scale study published in the American Journal of Kidney Diseases that analyzed more than 4,000 patients identified shortness of breath as one of the most frequently reported symptoms. There are two main reasons for this. The first is anemia. When the kidneys fail to produce enough red blood cells, less oxygen is carried throughout the body, forcing even simple movements to demand more energy. The second cause is even more concerning. Diseased kidneys are unable to properly remove excess fluid, which can then build up in the lungs, creating pulmonary edema. When fluid fills the air sacs of the lungs, oxygen can no longer pass efficiently into the bloodstream, leaving you with the terrifying sensation of drowning from within. 11. Changes in urination. Your urine serves as a daily snapshot of your kidney health, often revealing problems long before other symptoms appear. One of the most concerning warning signs is urine that consistently looks foamy or bubbly, resembling beer froth that lingers instead of fading quickly. This isn't harmless, it's a sign that protein, which should remain in your bloodstream, is leaking into your urine because damaged kidney filters can no longer hold it back. Research published in the Clinical Journal of the American Society of Nephrology identifies proteinuria as one of the earliest measurable indicators of kidney damage. Another important red flag is nocturia, waking multiple times during the night to urinate. This suggests that the kidneys are losing their ability to properly concentrate urine. Changes in urine color should also never be ignored. Urine that appears dark brown, cola-like, or tinged pink can point to the presence of blood. Equally important is the persistence of these symptoms over time. The longer they last, the greater the likelihood they reflect an underlying problem with kidney function. 12. Swelling in feet and ankles. You slip on your shoes only to find they suddenly feel too tight, or notice deep marks left behind by your socks. While many assume this is simply the result of standing too long, ongoing swelling in the feet and ankles can be a serious warning sign that your kidneys are in trouble. Under normal conditions, the kidneys act as highly precise filters, keeping the body's fluid balance in check by removing extra sodium and water through urine. Studies in kidney health journals show that when these filters are damaged, they lose the ability to clear excess fluid efficiently. The result is edema, fluid collecting in tissues, especially in areas pulled down by gravity, like the feet and ankles. What makes this swelling especially alarming is that it doesn't fade with rest. Unlike mild puffiness from eating salty foods, kidney-related edema tends to linger and worsen over time. As kidney function continues to decline, the swelling can extend further up the legs, and even affect the hands and face, signaling that the condition is progressing. 13. Fatigue and weakness. You open your eyes after what should have been a restful night, yet the exhaustion clings to you, making even the simplest tasks feel overwhelming. By mid-morning, you're already on your third cup of coffee, still searching for the energy to get through the day. This isn't ordinary tiredness, it may be your kidneys sending a distress signal. As kidney function declines, toxins begin to build up in the bloodstream, creating a poisonous environment that impacts every cell. One of the most significant effects is on your body's ability to carry oxygen. Healthy kidneys produce erythropoietin, a hormone that instructs the bone marrow to generate red blood cells. When kidneys are damaged, this production drops, leading to fewer red blood cells and reduced oxygen delivery to muscles and the brain. Research shows that anemia develops in up to 60% of people with chronic kidney disease. Findings published in the American Journal of Kidney Diseases confirm that this lack of oxygen leaves the body and mind in a constant state of fatigue. Too often, this relentless exhaustion is brushed off as a symptom of aging or stress, but in reality, it can be one of the earliest warning signs of impaired kidney function. These 13 red flags are not random or unrelated, they are your kidney's urgent cry for help, a final attempt to warn you before lasting damage sets in. From relentless tiredness that drains your strength to mental fog that clouds your focus, from swelling that alters how your clothes fit to skin changes that affect your confidence, each one is a vital chance to step in early. What makes this so crucial is that kidney disease has earned the name the silent epidemic, because signs often don't appear until over half of kidney function is already lost. But now you have the knowledge to spot these symptoms early. You're no longer among the 80% of people worldwide who could miss the early stages. Detecting problems early can dramatically slow down or even halt the progression of kidney failure. The sooner you act, the more treatment choices you'll have. If you've noticed any combination of these symptoms, don't delay. Book an appointment with your doctor and make sure to mention your concerns about kidney health. Just 2 straightforward tests, a blood test measuring creatinine and estimated glomerular filtration rate, along with a urine test for protein, can reveal kidney problems in their earliest phases, when treatment works best. If this video gives you valuable insight, type ready in the comments. It inspires us to keep creating life-saving health content. Tap the like button if you found this information useful, and share the video with someone who could benefit from it. And don't forget to subscribe so you never miss health tips that could protect your life. Thank you for taking the time to learn more about your kidney health. And remember, being informed is the strongest defense you have for safeguarding your future.